Good morning, and thank you for joining us for this webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care Division, Fiscal Administrative Services Division, as well as the Nutrition Services Division, as we have somebody on the team today from the CACFP group. This webinar is being held on November 20th, 2020, and is scheduled to run from 10 a.m. until 11 a.m. So again, thank you for taking some time to join us for this webinar. For those of you who may not know me, my name is Steve Profiter, and I'm the Director of the Early Learning and Care Division at the California Department of Education. Want to just wish you all a happy Friday before Thanksgiving. As we look forward to next week, we hope yours is full of joy and love. Our gatherings are going to be a little different this year. To that, I can attest personally. I like to open with acknowledgements for the team at CDE, but this week has an added layer of appreciation. We haven't taken as much time on previous webinars to talk about the transition of many CDE programs to CDSS, but we'll be touching more on that today. On Wednesday of this week, the team at CDE learned who was transitioning to CDSS or remaining at CDE. This is a work family that has worked hand in glove in some cases for decades, and who you all know through your interactions with them. While we'll be together for the next 7 months or so, I want to acknowledge the years of dedication this team has had to programs at CDE, and also acknowledge the work that is on the horizon with the transition to CDSS. So before I go on, I'll make a morning virtual coffee toast to this team. Thank you for all you've done and continue to do. And I'd also like to raise a virtual coffee toast to all of you. We are not through this yet, but we appreciate all you continue to do as we are in a spike of infections during this pandemic. But with hope on the horizon as we hear of promising results in vaccine testing. Through it all, we appreciate all of you persisting and working to the best of your abilities to support children and families. We see you, we hear you, and we will continue to be here to support you. A quick note as we talk about Thanksgiving and next week, the CDE will be closed on both Thursday and Friday next week in order to recognize and celebrate the holiday. As such, there will not be a webinar on Friday, November 27th. We will resume the weekly webinar series on Friday, December 4th. And with that, I would like to turn it over to Erica for some additional words.
Thank you, Steve. Erica Otiono, the Associate Director. Thank you all for taking part in this webinar. I want to tell you again how appreciative we are of all the work you are doing to sustain childcare services for families. Thank you. To the great team in front and behind the scenes for this webinar, thank you. Thanksgiving celebration is next week. Thanksgiving is the one holiday that each one of us, we have a chance to share our genuine gratitude for the things we hold dear. For me, I am thankful to all of you, my ECE community, my early childhood education community. During the program quality implementation PQI office part of this webinar, I will provide you with some updates and reminders from the PQI office, so stay tuned. And now I'll hand it over to Virginia.
Good morning, everyone. So my name is Virginia Early, and I'm the administrator of the Early Learning and Care Division Policy Office. Again, I want to reiterate the warm welcome from Stephen and Erica. Really, thank you for being here. Thank you for your engagement in our process. We definitely can't do this work without you, and you inspire us every day. For those of you who don't know, my office is lead over issuing all the guidance. So I've been a regular feature on these webinars. I don't have any specific updates today because we've really heard from the field that hearing about the fiscal timelines of different funds that we're working on getting out the door is of top importance to many of you. And so Andrea Johnson from our team will be providing a rather extensive update on all of that towards the end of our presentation. I also want to acknowledge, and Steve will go into this a bit more later, but we did send guidance out yesterday about what to do about transitional kindergarten eligible children and kindergarten eligible children that are in your programs. This is the same guidance that we've been sharing verbally in our webinars. So I want to make sure all of you have seen it. And of course, we're happy to answer any questions you have about that in the chat and also in the live portion of today's webinar. I also want to just stop a moment and really acknowledge two of my staff who work behind the scenes to make this webinar possible, Barbara Lindsay and Eric Dunk. You don't necessarily hear from them, but they are tirelessly working throughout the week to pull everything together and make sure we're successful. And it's really a labor of love for both of them. So I really want to acknowledge everything that they've brought to the table, as well as the rest of our team, including Alana, who's also from the policy office and is our amazing moderator. So I'll now turn it over to her.
Thank you for that, Virginia. And I also want to say a thank you to Eric and Barbara as well, as we all have to work with them this week to get this up and running for you all this morning. Okay, so once again, I'll be moderating this webinar, and I'm a child development consultant in the policy office, and I work with Virginia. And as I'm moderating today, we have a great team behind the scenes helping to answer your questions. From the policy office as well, we have Danielle Davis. From the PQI office, we have Cassandra Lewis, Crystal Devlin, Mai Zhang, Zir Zhang, Richard Miller, Katina Boulay, and Serene Yin. From the Child Development, Nutrition, and Fiscal Services, CDNFS office, we have Andrea Johnson, Corey Kahn, and Alan Lynch. And from the Child Development Management Implementation System, CDMIS, we have Rob Hom and Carly Nodahara. And once again, we're very charmed to have our colleague from Nutrition Services Division, Madison Philens. When we get to the live portion of the Q&A, as well as having our panelists who will be speaking today, we'll also have several administrators here to help answer your questions. We have Guadalupe Ramos Sendejas, Roseanne Pitts, and Donna Elmore. Our team is committed to being as responsive as possible. We won't be able to get to all, and we will do our absolute best to do that. We will do our absolute best to try and aim to get to all. I'll rewrite that for next time. A few kind reminders, please check the frequently asked questions webpage to see if your question's already been answered. And if you send a question in the Q&A feature, which many of you have already been doing, please give us as much information as possible. What type of contract, for example. And with that, I'll ask Stephen to come back and review the agenda.
Great, thanks Alana. And I'll just note that I've been getting the your internet connection is unstable message from Zoom. So hoping I can hang in there with you all until I can switch to phone audio. But in today's webinar, you're going to hear about, as we do each week, where we are with guidance, as well as some updates and timelines for some of the funding streams, as Virginia mentioned, which we'll hear during our fiscal updates. We're also going to provide updates from the program quality implementation team, so looking forward to that. As Alana mentioned, we're going to be taking questions in addition to working through, in addition to working through live questions, we'll be going over some of the questions that have been coming in to ELCD. We won't be able to get through, through every question. There's understandably, there's quite a few questions that come in, but we're going to do our best to address as much as we can. Please use, as Alana mentioned, the Q&A function in Zoom to put your questions in. And again, we're going to do our best to get through as many as possible, but whatever we don't get through, we will take back and address as FAQs on our website. And if we can go to the next slide. Perfect, thank you. So you heard a little bit about this from Virginia earlier, and we see a couple of questions in the chat, but we've received many questions from California State Preschool Program, which I'll refer to as CSPP from now on. Contractors requesting information on whether transitional kindergarten and kindergarten age children are eligible to continue to be served in CSPP for the remainder of this fiscal year due to limited options for TK and in-person kindergarten, what with schools doing only distance learning, and then kind of the back and forth that we're seeing as we're working our way through this spike in infections. CDE is working to develop guidance for contractors on this topic. Part of that is making sure that we've got the most up-to-date information. So we're requesting that all CSPP contractors fill out the SNAP survey that was sent out yesterday afternoon as soon as possible. And please no later than November 30th so that we can gather critical information needed to inform the upcoming guidance for serving 5-year-old children in CSPP during the 2021 program year. And as I mentioned a little earlier in one of my earlier slides, we do want to provide a few updates today on the transition of childcare programs to CDSS. You've heard this likely before, but the Budget Act for this fiscal year transfers a number of childcare programs to the California Department of Social Services. There are a total of 16 programs that are going to be moving from CDE to CDSS effective July 1, 2021. In about a minute or so, I'll cover the full list of those programs moving over. But in looking at what's going to be remaining at CDE for next year, that includes the CSPP, the state preschool program, the Inclusive Early Education Expansion Program, the American Indian Early Childhood Education Program, Quality Investments for State Preschool, and the majority of nutrition and school meal programs will be remaining at CDE. We know that our stakeholders have great interest and questions about the transition. And we want to assure you that we're working very closely with the Department of Social Services to ensure the transition will be as smooth as possible. Many members of our CDE family will shift their employment to CDSS on July 1. They are, as we all are, deeply engaged right now to help think about and plan for how the work will move over, always keeping in mind the goal of providing seamless services to children and families and easing the burden on our contractors and providers. Our team is engaging with the team at CDSS almost daily, and I want to thank them for all of their hard work. I can't underscore enough the amount of work the team, the CDE, is putting in to ensure a smooth transition, whether it's through the daily work or meeting with CDSS weekly to run through key program issues and introduce the work to the team at CDSS. This is a dedicated team at CDE working towards an end goal of a smooth transition and to continue to support children, families, and programs. Whether it's at CDE or CDSS, this work is a labor of love. With regard to the programs and the staff that will remain at CDE, we are looking forward to opportunities to improve how we do business and concentrate on the things that matter most for children, families, and programs. For reference, the CSPP program enrolled a little over 141,000 children in the 1920 year, and we know it has positive impacts on child development and development of children as they transition to school and through school. We look forward to working with you to continue to implement this program and find ways to strengthen and expand its reach. We are also committed to ensuring that our contracts don't face additional burdens by operating programs housed at both CDE and CDSS. And we look forward to your guidance and support on the best ways to do that. The transition process is new to all of us, but we are committed to doing great work collaboratively on behalf of California's children and families, and the contractors, the programs, and providers who serve them. Thank you to the CDE staff who are working so hard on this, and thank you to all of you for your partnership along the way. So to recap the programs moving to CDSS effective July 1, 2021, it includes both the stages of CalWORKs that are administered by CDE presently, which is stage 2 and stage 3, the general child care and development programs, otherwise known as CCTR, the alternative payment programs, otherwise known as CAP, CAPP, migrant alternative payment programs, or CMAP, CMAP, migrant child care and development programs, or CMIG, child care and development services for children with severe disabilities, child care and development facilities capital outlay, the early learning and care workforce development grants program, the California Head Start State Collaboration Office, the child care resource and referral programs, local child care and development planning councils, the California Child Care Initiative Project, and other quality improvement projects, the Child and Adult Care Food Program, and then finally the Child Development Management Information System and other related data system as they pertain to program services and systems. So it's a long list, but just wanted to make sure kind of we went back through it, and I'll stop here and I will turn it over to Erica for our PQI portion of this morning's program.
Hello, everyone. Again, this is Erica Otieno. I'm back. So just to give you some quick update from the Program Quality Implementation Office, PQI. The first bullet says continued funding application, otherwise known as CFA. The CFA has been extended, the deadline has been extended to Monday, November 30th, 2020. Thank you to everyone who submitted theirs already. If you have not, please do so by November 30th. The next bullet is Program Quality Management Bulletin. The Management Bulletin on Program Quality is in the final phase and will be released soon. This MB will provide guidelines for many of the questions that you have asked us regarding environment rating scale, parent involvement, and so on and so forth. Please be patient with us. We are incorporating feedback from stakeholders, and it will be published soon. The next bullet is about resources, available resources. We encourage direct service providers, including Family Child Care Home Education Network programs, to utilize resources on West Ed website. Whether you're doing distance learning or in-person or a combination, the resources like the short video clips they have, frequently asked questions, they're all very, very helpful for completing the desired result developmental profile known as DRDP. Please visit the website and use the resources. So let's do slide 2. Now we're going to talk about our famous webinar Wednesdays. This month, December, is going to be a busy one. We are going to start out December 2nd. We're able to house about 500 participants the last time, but we saw there's a need for more. So the December 2nd is a repeat of the training and is scheduled for December 2nd, and you will get information shortly. If you haven't, please contact your consultant. It's only for those that will be reviewed for this fiscal year. The next one, following December 2nd, we have another one, very exciting one. That's December 9th. This is going to focus on the results of the Improper Payments Elimination Recovery Improvement Act, which is, we call it IPARIA. This is a review that we do once every 3 years and then send a report to the federal government. So this is our opportunity to share with you why we do the review, the findings, and what we have promised the feds that we're going to do moving forward. Very, very exciting one too. CSPP contractors are not required to participate because CSPPs do not go through the error rate. The next one we have to conclude the month of December is on December 16th. December 16th, the focus of that training is going to be for new contractors. We call it the new contractor orientation. It's for new agencies. So coming soon, if you're brand new, that's another exciting one. As you know, PQI, we are responsible for monitoring and also providing support. So the federal program monitoring, we call it FPM, that's for LEAs, local education agencies. That's what we're completing that as now, and we want on behalf of all PQI staff, I want to say thank you to all of you. It's been going smoothly. The consultants are reporting how well the reviews are going in a virtual environment. Thank you. Uploading your documentation, they're reviewing them, providing feedback. It's going very well. Thank you. Starting in January, we'll begin the remote monitoring compliance review for all other selected agencies. We hope to conclude all monitoring by May, latest, early June, just maybe 1 or 2 in early June. So this actually concludes the part for PQI. Again, for this Thanksgiving, know that we are very, very thankful and appreciative of all you do for children and families in your communities and beyond. And now I will turn it over to Corey for fiscal update.
Thanks, Erica. This is Andrea. I'm going to take the fiscal updates today. We have quite a few, as Steve mentioned in his opening. We're really excited to be able to provide so many fiscal updates this week. We've made a lot of progress this week, so I'll be going over through several updates on specific allocations. We'll also be sending these updates through an ELCD listserv so that you'll all be able to have this information in writing and, for easy reference. In addition to funding updates, I'm also going to go over and provide some very important reporting deadline information, which will also be incorporated in the email communication that's forthcoming. So first, an update on stipends. The stipend allocation related to Stage 2, Stage 3, CalWORKs Alternative Payment, or CAP, the California Migrant Programs, or CMAP, were issued by the State Controller's Office yesterday and will be mailed to contractors today. As a reminder, the CDE processed these allocations as an apportionment payment outside of the Stage 2, Stage 3 CAP or CMAP contracts. And funds allocated to the local education agencies, or LEAs, must be distributed through the county treasurer. And so the LEAs should therefore contact their county treasurer office to coordinate the transfer of funds. So when I say that they will be mailed today, the expectation is that you will have the checks in the mail by early next week. As stated in previous webinars and also in the fiscal year 2021 Child Development Contract Changes for Alternative Payment Contracts letter that we issued, if a county contracts out the administration of Stage 1 to an alternative payment contractor, the AP contractor will be required to issue Stage 1 stipends to the Stage 1 providers. These AP contractors received an email from their fiscal analyst this week informing them of the stipend allocation that they would receive for Stage 1. We expect that contractors will receive their allocations for Stage 1 as stipends the week of December 7th. So now I have an update on the general child care expansion funding. We're going to begin issuing contract amendments beginning the week of November 23rd, which is next week. For those programs that are required, that require startup funding, and or programs that have a site license or the LEAs that are license exempt. So these programs we have been in close communication with and have those the paperwork ready to go to begin to process those contract amendments. Amendments for expansion will be processed throughout the year as necessary. So for those programs that aren't quite ready, they don't have the site license yet, please do continue to be in close communication with your regional consultant and your fiscal analyst so that we can process those amendments as soon as you have that paperwork ready. Next, fiscal updates on the allocation to reimburse providers for up to 14 non-operational days. I'll talk a little more extensively about the funds associated with the 14 non-operational days because we haven't talked about this in as much detail as in the last couple of months as the others. So Senate Bill 820 allocated $31.25 million to reimburse state subsidized childcare providers for providing short-term childcare for up to 14 days to eligible children when the primary provider is closed due to COVID-19. Pursuant to SB 820, contractors are required to report to the CDE the use of the 14 additional operational days due to COVID-19 and the associated costs. Therefore, effective September 1st, 2020, all C2AP, C3AP, CAPP, and CMAP contractors were required to report data associated with provider non-operational days for instances where the child received care from a secondary provider. This information will be utilized to ensure that contractors have sufficient funds to reimburse the secondary providers. The CDE will issue these funds until funding is exhausted per SB 820. So the data that the APs are required to report for this purpose are the number of children requiring care from a secondary provider, the sum of all days children received care from a secondary provider, and the total cost associated with paying secondary providers due to the primary provider's closure. So I just want to reiterate and to be clear here that the funds that were provided are to ensure that contractors can reimburse a secondary provider when a child received care from a secondary provider. So the data reported in these fields to CDNFS on our online system should not represent any days or information related to the primary provider. The primary provider's reimbursement is being made from the contractor's original funding and not from this additional funding. So this revised CDNFS report became available to contractors right before the September report was due. Based on a review of the submitted reports for September, there are some contractors who submitted their September reports prior to the caseload report being updated. So if you did submit your September report and you didn't see those fields on that online database, then you submitted the report before those revised caseload reports became available, and you may need to submit a revision related to these the use of the 14 non-operational days. Please submit your report if you need to do so by November 25th. Additionally, contractors are reminded that the deadline to submit their October alternative payment and CalWORKs caseload reports is November 20th, which is today. Allocation of these funds will be conducted throughout the year, but the first allocation for these funds will be based on the information that you submit on your September and October reports. So in order to receive the first round of allocations, contractors must ensure that they submit their September and October reports timely. The data will be used to issue contract amendments, which we expect to be issued on or about December 18th. Okay, now I'm going to give an update. The next fiscal update is on July and August 2020 family fee waivers for direct service contractors. The CDE received $4.2 million to provide direct service contractors with additional funds to cover the loss of income incurred by contractors as a result of the waived family fees for July and August. Direct contractors were informed on October 27th, 2020, that allocations would be based on the information reported in the field online in our CPARIS database that's titled Waived Family Fees for Certified Children, July and August. And they were also informed that, that you must submit accurate data by Friday, November 6th to ensure an allocation. We're going to provide an additional extension to this date and allow contractors to report until Wednesday, November 25th. That's Wednesday of next week. Reports not submitted by Wednesday of next week will not be considered for an allocation, and there will not be an additional extension to this. Additionally, we recognize that CFCC contractors submitted their reports prior to that update I was just mentioning online, that we made online. So CFCC contractors that need to revise previously submitted data must revise the necessary reports and submit no later than November 25th as well. We have already started to reach out to those specific contractors. So you'll likely also hear from CDNFS to inform you of that. CFCC contractors who have not submitted these revised reports by the deadline will also not receive an allocation of these funds for waived family fees. We expect that direct service contractors will receive their augmentations for the waived July and August family fees on or about December 18th. Okay, next update is in regards to the forthcoming allocations related to that $110 million that we've been discussing. I think that we discussed in the last couple of weeks, that was recently received through the executive order. So this first slide here is in regards to waived family fees September through June. September through June waived family fee allocations. So remember that family fees waived for families that are not receiving in-person care because they are sheltering in place or distance learning. These allocations are for all contract types that collect family fees. The allocations will be based on December reports, which are due January 20th, and contract amendments will be issued on or about February 22nd for this specific allocation. Okay, so lastly, I'd like to address the $80 million allocation provided to cover costs for full-time care for school-aged children, as well as an extension of emergency childcare. So this was funding also provided as part of that $110 million. First, to be clear on the costs that we're speaking about when we're talking about increased costs for school-aged children requiring full-time care, we're talking about the children who were previously receiving part-time childcare services that contractors had budgeted for them to be receiving part-time care. And now that schools are closed due to the pandemic, that these children are now requiring full-time care, which created that increased cost pressure. So as you can see here that we outlined on the slide, the first allocation will be based on CAP October emergency childcare caseload data, which is due to today, November 20th, to CDNFS on the online reporting system. Contract amendments will be issued on or about December 18th, which is a date I've mentioned a few times now. Allocations can be used for either, these first allocations can be used for either emergency childcare or the costs that are associated with the school-aged children that require full-time care. The second allocation will be based on, again, the CAP emergency childcare caseload data, but from December data, as well as data collected via a survey regarding the need to provide full-time care to school-aged children. So the second contract amendments will be issued on or about February 22nd. Excuse me, I have it a household. The CDE will release a survey in mid-December to contractors to collect data related to increased costs associated with school-age children. So I want to add here that I can't stress enough the importance of timely and accurate reporting, as your reports are the basis of these allocations and all of the allocations that I just discussed. And if we do not receive them timely, we cannot keep to this timeline. In this instance, that also includes timely responses to the survey for full-time school-age childcare that's forthcoming, that we are currently developing. These timelines are very ambitious, and they really do require us to work together. To give you a sense of volume, we're looking at about 1,125 contract amendments for this time period in December. And so to stay on track with the timelines that I'm providing here on this slide, as well as in previous slides, we ask you to do a very thorough review of your data before you submit it to the CDNFS. Also, what I want to point out in the timing of these allocations for this $80 million here is that our primary goal here is to provide sufficient funding to contractors so that they are able to reimburse providers timely, and so that you do not have to disenroll any children. Because we need additional data to allocate funds for the cost of full-time school-age care. Excuse me. Sorry for the background distractions. Okay, so because we need additional data to allocate funds for the cost of full-time school-age care, what we're doing with this timeline is allocating funds in December with the data that we do have available, which is data on the emergency childcare enrollments. And this is the population that we know for certain is not funded for most contractors past December. So we want to get this funding out as quickly as possible. When contractors receive their augmentation in mid-December, the funds that are received can be utilized for either emergency childcare enrollments or costs associated with school-age children. This allocation that we are providing in December won't be restricted to one or the other. Then we expect to have the remainder of the augmentations completed in February to, again, ensure that you have sufficient funds to continue care for currently enrolled families. So we hope that you find these updates useful, and we'll certainly keep updating you as we have additional information to share. My very last comment I will make is to remind all contractors that if you feel you are going to have a cash flow issue, to reach out to your regional consultant and CDNFS fiscal analyst as soon as possible. We've been very successful working together in addressing cash flow issues this year. But the solution is different depending on what is causing the issue and if the issue is, with the CalWorks contract or another contract type. So the earlier you reach out to us, the more likely we'll be able to address the problem timely. So please do so as soon as you identify an issue. And that's it from my fiscal update. So I'll turn it back to Alana for the live questions and answers portion of the webinar.
Thank you very much, Andrea. And I was very thrilled to see your household in the background there. Okay, so we've gotten a lot of questions and our team has been responding. And so we appreciate your engagement this morning. The first question I have will be for Rob. So we have a lot of folks were asking about getting a copy of the survey ahead of time in order for answering the questions. Can you speak to that, please? Or how they can get a copy?
Good morning, everyone, and thanks, Alana. Definitely, we can supply you with the SNAP survey questions in advance. What I'll ask, or what I'll do here is I will put the CDMIS email address here in the chat box, and I'll ask that you email us requesting for those questions, and then what we'll do is we will promptly reply back with those questions.
Perfect. Thank you, Rob.
Can I add something to that, Alana?
You
Or sorry,
absolutely
Rob,
can, Virginia.
So I just want to alert people to the fact that the survey is set up with skip logic. So when you fill out the answer to one question, other questions will appear below it. And so just be very careful if you have looked at sort of a Word document version of it and sort of come up with your answers and then are inputting it into the web form. Be very careful to pay attention that you're putting the right numbers in the right boxes. Because we want to make sure that we're accurately capturing your data.
Absolutely. Thank you, Virginia. And also, there's been a lot of questions about if there is a printed list of all of the programs that are transitioning to CDSS. There is a website that CDSS has, and on that website, and I'm going to ask that Mai put it in the chat box, or if someone else can put it in the chat box. And on that website is a complete list of those programs. So that way you can get a full list, because it's true. When we're speaking, it's a little bit hard to write down everything that's being said. So we don't have a printed sheet, but there is a website that has that listing, and we can get that website out for you. Okay, so there are a lot of questions in the chat also about the 3-hour minimum. So I'd like to invite Lupe and perhaps Erica as well to speak to this. So I'll just read out one of the questions, and I think this will also go to answering most of the ones that we've received regarding this. So one of them, so we've gone to a hybrid program with our LEA. Students will be on campus 2 days a week. Start time is at 8:30, release time is 11:15, 11:30, depending on when buses leave. What if we don't meet the minimum of 3 hours on site?
So this is Lupe. Thank you. That is a statutory requirement that programs operate from 3 hours, no less than 3 hours, 3 hours to less than 4 hours per day. Those are operational hours. So if you are providing in-person services, you should be providing at least 3 hours. Your operation time should be at least 3 hours. So if you cannot, please contact your consultant to see what.
I'm sorry, what was that last part, Lupe? I think I heard a lovely tone instead. You said to contact.
Is a requirement. Now that requires distance learning. Yes.
Okay.
So there may be specific reasons. So I want, I don't want to misspeak on a specific situation, but as I said, it is a statutory requirement. So it's not like we can change that.
Okay, thank you, Lupe. Okay, let's see. So there's also some questions that we have about the emergency childcare funding and the augmentation. So can I have Andrea come back? So one of them was for the emergency childcare, contract amendments will be issued around December 18th, and when will checks be mailed to contractor?
Yeah, thanks for that question. With anything that requires, any funding that requires a contract amendment, so in all of the funding that I just went over, that's everything except for the stipend allocations. Those do not go through a contract amendment, but all others require a contract amendment. So once that contract amendment is signed and returned by the contractor, you can generally expect you will receive a payment within 6 weeks.
Okay, thank you very much. So we also see that there are lots of questions about the CSVP 5-year-old. So while I'm trying to pull one, oh, well, while we're pulling that, oh, I see, Corey, you asked that to be answered live, and it was answered live.
I can address the CFCP 5-year-old issue, Alana.
Thank you. I've been trying to just pull one of the many questions that are still open. I appreciate that. Please do.
Yeah, so we know that there are a lot of questions, and I think I'll just try to hit on a bunch of things, and then Alana, you can tell me what I missed, and I can add those pieces if that works. So, just to sort of lay out some basic facts, a lot of people are saying, well, we've always been able to enroll kids, you know, and either have them enroll in TK or have them enroll in a CFPP. And that was true up until last year. So starting July 1, 2019, the law changed about the ages of children that were eligible for the California State Preschool Program. So there are new definitions of 3 and 4-year-old children that are found in Education Code Section 8208. We implemented those changes last year through our funding terms and conditions and program requirements, but as is typical sort of in the first year of a new change, we sort of work with our contractors to help them implement. And so the reason this question is coming up is, you know, in a normal year, these children typically would have swapped over to, you know, kindergarten or TK or whatever. But now we've got a lot of families that, you know, in-person TK in kindergarten isn't an option. And so that's where, you know, folks are asking us, okay, well, we know the law changed, but what about, you know, 12-month eligibility provisions if they were already enrolled? And so that's kind of where, you know, we've given the guidance that we've given, you know, don't enroll any additional children that don't meet the age eligibility requirements in Education Code Section 8208. But if you've already got some in there, don't disenroll them and don't recertify them, and provide data to us on how many you have. If you are able to transfer them into a kindergarten program, a TK program, you know, please do so. If you are able to convert them into your CCTR program, please do so. But we really want to get more information about the issue. And I hope everyone's still hearing me, because this is a great reason to join on phone audio because my internet died. So I'm going to stop there, and Alana, tell me if I'm missing anything.
No, I think you did. And wow, sorry, internet. A lot of folks on our end have been having some internet troubles this morning. So we're very thankful that we're able to do this. So I'm going to call Andrea back in for round 2 about family fee reimbursements, specifically around with September and June. Or this September.
Thanks, Alana. So this somewhat ties into the question that I just answered, but I just wanted to speak specifically to the family fees reported that are waived between September and June. Our office, as we process payments, you know, the monthly apportionment payments, now that family fees are not, now that contractors and providers don't have to absorb fees that are waived, that dollar amount that you're reporting to us will not be subtracted from the reimbursement amount. So if you're not currently earning or over earning your contract, those payments will just naturally be incorporated into your monthly payment. If you are, you know, earning or getting close to over earning, then the augmentation will be required to be able to, you know, bump up that reimbursement amount because there's not enough in your contract. But I just did want to make clear that because you no longer have to absorb them, they will no longer be subtracted from that that calculation that essentially, you know, forces the absorption by the contractor and provider.
Okay, thank you. I'd like to invite Rob back for a quick moment. Hey, Rob. So we've got someone said that they completed the SNAP survey with 0 enrollment because it's been recorded that they've not provided services in CDMIS. Is that something that would happen? Is that correct?
That sounds fine, assuming that no services were provided. The agency did do the right thing by marking no services in the CDMIS. With regards to the SNAP survey, they'll also want to input zeros as means to be able to submit and complete that survey. So to answer the question, yes, please put zeros in response to the survey questions.
Can I clarify that, Alana?
Yes, Virginia.
So the survey is really to augment the fact that CDMIS is not capturing these children. And so if you are serving children that fall into these age brackets, please do fill out the survey. Please put the number of kids, don't put zeros. If you actually do have 0 children in these categories, please put zeros, but don't put zeros just to mirror what is in CDMIS.
Okay.
Thanks,
you.
Virginia. And one more point of clarification, the survey is specific to only our California State Preschool Program contractors, or CSPP program. So any other program types are not applicable with regards to this survey.
Can you repeat which of those contracts again, please?
Only the CSPP, or the State Preschool Program contract.
Okay, thank you. Okay, so I know that we're getting close to the end of our hour. I would like to call Administrator Donna Elmore, as we've had a few questions regarding, is there any new guidance regarding ECHRS requirements and parent survey requirements?
Yes, I'd like to share that there's a management bulletin in the works, and it should be coming out in the next week or so. And in that management bulletin, it will explain that we are continuing with all of the requirements officially by regulation. However, the management bulletin will address strategies and ways to meet the requirements given the circumstances at around the COVID-19.
Excellent, thank you very much. Okay, maybe we can get into one more. So Virginia, can I ask you back? There seems to be just a slight confusion about, so 5 years old between September 2nd and December 1st, or is it 5 years old between September 2nd and December 2nd?
Oh boy, let me pull up the ed code. Danielle, if you have this one memorized, go ahead.
Danielle, we'd love to hear your voice if you're there, but if not, that's fine.
Okay, so let me make sure I'm saying this correctly. If they turn 5 between September 2nd and December 1st, they are TK eligible. If they turn 5 after December 2nd, they can be served in CSPP.
Excellent. Do you mind repeating that once more for those who are really good with audio learning?
Okay, so if they turn 5 between September 2nd and December 1st, they are eligible to go to TK and no longer eligible for CSPP. If they turn 5 after December 2nd, then they are eligible to stay in CSPP.
Is it, and I think there's a clarification from Rob that it's on or after December 2nd.
Yes, thank you,
Yes.
Rob.
I know it's bad. The laws can be very specific, and that's what we get to work with. Okay, so while our open questions are still being answered by our team, I will begin to read out the resource links that we have. Thank you, Eric. So once again, on any webinar slides, including today's, management bulletins and frequently asked questions can be found on ELCD COVID-19's guidance webpage at https://www.cde.ca.gov/SP/ELCD COVID-19.ASP. You may also submit additional questions to the ELCD emergency inbox at elcdemergency@cde.ca.gov. Again, when you submit those questions, please be as explicit as possible. Tell us about your contract, tell us who we should contact, and give us as much information about your question as possible. To contact your assigned PQI office regional consultant, a list of those consultants can be found on the ELCD Consultant Regionals Assignment webpage. That's at https://www.cde.ca.gov/SP/CI/assignments.asp. And as we all know, consultants are most easily reached by email. You can also call at 916-322-6233. And to contact your child and adult care food program county analyst, such as Madra, a list can be found at https://www.cde.ca.gov/li/NU/CC/CACFP contact.asp. Okay, and I'd like to invite Steve and Erica back for our last minute, as we are also, our team is feverishly trying to get these questions answered for you. And Stephen and Erica. Oh, I saw the unmute button.
I'm here, but I wasn't
Unmute.
sure. Oh, there she is. All right.
I'm mute. Yeah. Thank you so much, everyone, for participating. And please, for direct service contractors, please, and all contractors, please continue to reach out to families who are not engaged in your programs, either physically or virtually. Continue with your efforts to re-engage them, with all the flexible opportunities that you have been using, packets, email, text messaging, and other ways. And again, remember that PQI consultants, administrators, and me, we are always available to you. Enjoy the Thanksgiving celebration, and we'll see you in 2 weeks. Over to you, Steve.
Thank you, Erica. Yeah, on behalf of the team at CDE, we thank you all for taking time out of your morning to join us for this morning's webinar. We could see from all of the questions that are coming in that we could spend hours going through this. And just to reiterate, as we're implementing guidance, there's more that I know that folks would like us to be able to do. But essentially, it kind of boils down to what our authority is and funding available. So appreciate patience and understanding with that. And just as we close out here, as a reminder, and as was mentioned at the beginning of the webinar, next Thursday and Friday, CDE is closed. So our weekly webinar series will resume on Friday, December 4th. And then finally, I'd just like us all to take care, be safe, and be kind to one another. We all have a role to play in helping to stop the spread of the coronavirus. So when you go out, please wear a face covering. We're in flu season, and we need to be more vigilant, even more so to stop the spread of the coronavirus. And with your continued efforts, we'll be together at the end of the finish line of this marathon. So thank you for joining us. Be well. Have a wonderful Thanksgiving week.